Hello, it's Dr. YouTube here. I regularly upload medical educational videos. In today's episode, I will talk about the spectrum of alcoholic liver disease, so fatty liver, alcoholic hepatitis, liver cirrhosis, and its complications. We'll touch on pathology as well. First thing to know, alcohol gets converted into fat and is also highly toxic. It induces inflammation. How does it do it? Well, it damages some hepatocytes, the liver cells, and induces a neutrophil infiltration. Cells die, Maori body gets formed, and these are basically eosinophilic, so red cytokeratin filaments, as shown here. So these are Maori bodies. Now, you can have acute inflammation, predominantly neutrophils, but if it carries on, you can have chronic inflammation and fibrosis forms, and that's where cirrhosis comes in. It's important to touch on the anatomy as well. So what happens is the liver is composed of many units such as this. You've got hepatic artery, supplies oxygenated blood, portal vein, so the nutrients, deoxygenated blood, and the bile duct. Now, this is the central vein, which goes to the heart. So things go in this direction. So hepatic artery to central vein, portal vein to central vein. It goes the opposite direction for the bile duct, central vein to the bile duct. Now what happens is alcohol, as I said, induces inflammation. You've got here called Kupffer cells. Kupffer cells are basically macrophages, shown here. These macrophages get activated and they stimulate fibroblast formation, so fibers, so fibrosis. So when you have chronic activation of these Kupffer cells, you get fibrosis forming, and that is when you have cirrhosis. Now, cirrhosis is irreversible. Okay, that's the key point. It's irreversible. But anything before all this chronic inflammation, in other words, fatty liver, for example, because alcohol gets converted into fat, or the acute inflammation phase, so the hepatitis phase, is reversible. So it's important that you tell your patients that they can reverse their hepatitis and they stop drinking. Now, what happens when you have that tons of fibrotic tissue? Well, you get portal hypertension. Now, normal portal pressures, so let's just do a diagram here. You've got your portal vein, you've got your SMV, superior mesenteric vein, inferior mesenteric vein, and splenic vein. So they all go in this direction, back to the liver. The normal pressures here are rather low in the portal vein, less than 10. But in portal hypertension, you can have more than 12, even double 20. And that is bad. So the reason for that is because you've got connections. And the portal liver is not used to such a high pressure system. When you have portal hypertension as a result of all that fibrosis, due to Kupffer cells and so forth, you can get things such as a large spleen. So remember the splenic vein? Yep. So the spleen enlarges. Remember the spleen stores blood, stores platelet. So you can have anemia, you can have low platelets. You also have anastomosis between the portal vessels and the systemic vessels. So the gullet, you have esophageal varices, so bleeding inside the stomach. You can have paraumbilical veins, so you can have caput medusa, so dilated veins around the stomach area, around the belly button area, and hemorrhoids due to a dilated superior rectal vein. We'll touch on hemorrhoids. And so, for example, as you can see here, very briefly, hemorrhoids divided between internal and external hemorrhoids. Internal hemorrhoids are above the pectinate line, as shown here, pectinate line above. So this is an internal hemorrhoid. These are therefore external hemorrhoids. External hemorrhoids are painful. Internal hemorrhoids are not painful. Internal hemorrhoids are lined by simple columnar cells, and the external hemorrhoids are lined by stratified squamous cells. So as we said before, the three commonly tested exams, the three portal systemic collaterals. So think, first of all, the gullet and your belly button and your buttock. So in your gullet, you've got esophageal varices, so connection between the gastric and esophageal. You've got your belly button, so caput medusa, and your rectum, the hemorrhoids. So now how do we treat alcoholic cirrhosis? Well, it all depends. So, if you catch it early, you stop drinking, you stop the fatty liver, you stop the inflammation, then it is reversible. But if it's beyond that, unfortunately, it is not reversible. Now, some patients are candidates for liver transplant, especially if they're sort of 6 months abstinent from alcohol. It's also important that they have good family support. The complications, you can try and deal with cirrhosis independently. So you monitor for varices, remember, because of esophageal varices. You do routine endoscopy camera tests. You try and get rid of the varices. You can give them beta blockers, which vasoconstrict. Okay. If they develop ascites, you can give them diuretics, such as spironolactone. If they develop encephalopathy, remember the liver breaks down all the toxins. The liver doesn't work, it doesn't break down toxins. The way to reduce encephalopathy is by giving them laxatives, right? And also, to reduce portal hypertension, you can also remember your portal vein here. You can produce a shunt, so called a TIPS shunt, transjugular intrahepatic pososystemic shunt, connecting the portal vein to the IVC hepatic vein. So that is your TIPS procedure. Contraindication, for example, would include if you've got hepatic encephalopathy, because all these toxins will just bypass and your brain will be screwed up. So let's quickly recap. The pathology of alcoholic liver disease. Alcohol gets converted into fat. It's also toxic. Induces a Kupffer cells, as shown here. You get the fibrosis formation. If it's long-term, increasing the portal systemic pressure. Portal pressure is usually less than 10 to 12. If it's high, you get shunt formation. And that can affect the esophagus, esophageal varices, your bum, so your internal hemorrhoids, external hemorrhoids, and also caput medusa. Other complications of alcoholic liver disease, so ascites. Treatment would be diuretics. You can have liver failure. Treatment would be, liver transplant if they are abstinent from alcohol for 6 months at least. You can also have splenomegaly, and as a result, you can have low platelets and low hemoglobin, as shown here. I hope you've enjoyed my video. If you do, please give a thumbs up, like, and subscribe. Let's look after the liver and try and touch alcohol a bit less for the new year. Take care.